of the other faculties, registrars, Bursa, University of Sri Chardanapura, Dr. Varuni Tennakon, the Chair, Research Committee, Faculty of Medical Sciences, and all the team members, Research Committee, Faculty of Medical Sciences, senior professors, all the academic members, distinguished guests, and my dear colleagues and friends. I'm indeed privileged and honored to be here on this stage to deliver the Faculty of Medical Sciences Oration 2023. I thank Dr. Varuni and her team for selecting me and inviting me to deliver this oration, where I'm going to share our important findings from the Department of Microbiology. Leptospirosis along the road to unraveling the enigma of host bacterial interactions. Leptospirosis is endemic in many of the tropical countries, including Sri Lanka. However, unlike the other common infections like dengue, malaria, little attention is being paid on leptospirosis. So this is a bit unfortunate, and therefore there is a huge gap in knowledge related to the pathophysiology of leptospirosis. And the other important thing is the diagnosis, especially the confirmatory tests, are only available at Medical Research Institute, that is in Borrell. So clinicians who work in rural areas has to send the samples to MRI Colombo if they need a confirmatory diagnosis. So this is a bit unfortunate. And also, it is important to note that leptospirosis mimics many other common infections like dengue, hantavirus, rickettsial fever. As a humid country with humid tropical environment and socio-economical conditions in Sri Lanka favor it as an ideal breeding niche for this pathogen. Leptospirosis is caused by a spirochete, Leptospires, and there are saprophytic strains. Those are free-living as well as pathogenic strains. The first case of leptospirosis was reported from Colombo in 1959, and in 1991, this was identified as a notifiable infection. And Sri Lanka is considered as a country with high incidence, and incidence is high in western, southern, central, and north central provinces. The estimated annual incidence of 52.1 for 100,000 population and 730 annual deaths. Based on the SLMA expert talk on leptospirosis, based on the presentation, up to now in 2023, 1,223 cases were reported. And recent past, in 2020, there was an outbreak of more than 8,500 cases. And in 2008 also, we had an outbreak of more than 7,400 cases. In 2022, the highest incidence was reported from Ratnapura district. Transmission occurs directly or by indirectly from animals to humans. Infected animals carry the pathogens in their renal tubules, excrete through urine, the water and soil get contaminated, and there they can survive for up to months. The human get the infection through skin lesions or by mucosal membranes. The organism enters to the bloodstream, disseminates, and then enters to the organs and causing tissue destructions. Rodents are the main reservoirs, so therefore it is also known as rat fever or meune. And also cattle, pigs, and dogs are considered as reservoir animals. Coming to the clinical manifestations, it has a wide range of clinical manifestations, including mild flu-like symptoms and to the Wills syndrome, with a case fatality up to 15%. Wills syndrome is characterized by acute renal insufficiency, jaundice, and hemorrhage. In pulmonary hemorrhagic syndrome, the case fatality is high as up to 50%. As I said before, the confirmatory diagnosis is always a challenge, as these confirmatory tests are only available at MRI. During the acute phase of illness, that is up to 10 days, we can collect a blood sample and send for PCR or culture, which are confirmatory diagnostic tests. Then, during the immune phase, we can collect acute and a convalescent sample and send for microscopic agglutination test, which is again a confirmatory test. Specific IgM detection is considered as a presumptive identification test. And also, we know that 10% those who get the leptospirosis will lead to severe form of infection. The remaining 90% or more than that will get the asymptomatic infection or will get mild flu-like illness or recover without any complication. So the reason behind this is still an enigma. We believe and hypothesize that there is a big role in host factors which contribute to the pathophysiology of the severe outcome. And also we believed that bacterial factors, that is the bacterial virulent factors, the circulating strain, the seroa, has partly contribution for this disease severity. So we wanted to explore this area. First of all, we had several discussions with clinicians. We wanted to find out their ideas. And then we did an extended literature survey. And we found out that this happened back in 2013, only little papers were published, especially with regard to the immune factors. And in Sri Lanka, two main groups were into leptospirosis research, one from Colombo, that is headed by Professor Senaka Rajapaksa, and the other one is from Rajarata, headed by Professor Sunetha Gampodi. They were doing good research, but they were mainly into identifying early markers. So with that backdrop, we thought of exploring this area, and we wanted to correlate and to find out whether there's a contribution of these host factors as well as the bacterial factors for the outcome of the disease. So how did we do this? Our study population was clinically suspected patients with leptospirosis. These patients were recruited by the clinicians adhering to the WHO LURG criteria. And based on that, a confirmed case was defined as positive for either PCR, MAT, or culture. Negative or presumptive case was defined as negative for either MAT, PCR or culture, however, positive for the presumptive test IgM, specific IgM. Definitive diagnosis of dengue, typhoid fever, and other infectious diseases were excluded. The study was conducted during 2013 to 2021 period. And also, before moving to the proper study, based on the ideas we got from the clinicians, first we wanted to validate the leptospirosis case definition, as this clinical, the diagnosis is mainly clinical. So that time, there were 3 case definitions. The suspected case definition published in 2016 by the Ministry of Health, and then CDC case definition 2013, and WHO case definition 2010. So the Ministry of Health 2016 was the latest case definition. So when we summarize these three, we can clearly see in 2016 latest case definition, the patients with acute illness, febrile illness, with at least any one of the following, including several symptoms were included, and or history of exposure and or evidence of organ involvement. When going to the CDC case definition, the clinical presentation includes history of fever within the past 2 weeks and at least 2 of the following clinical symptoms. And when it comes to the 2010 WHO case definition, a suspected case involves a person presenting with acute febrile illness, headache, myalgia, and frustration. So, how did we do the validation? For this study, we included 372 clinically suspected patients, out of which 156 were presumptively diagnosed as leptospirosis, 108 were confirmed cases. Coming to the results of the performance characteristics of suspected case definitions, Ministry of Health, the case definition published in 2016 had the highest sensitivity compared to the other 2. However, the specificity was less. The highest sensitivity may be due to in that they have included many symptoms to avoid missing any case. And specificity was less, maybe due to the false negative results obtained using these 3 confirmatory tests. Why? Because when at the time of collecting the blood sample, most of these patients were on antibiotics. So we ended up with false negative PCRs. And back in 2013, MRI only had this single titer mat, which again, the sensitivity is less. So finally, the conclusion, the suspected case definition published by Ministry of Health in 2016 had a higher sensitivity compared to the other 2 case definitions. Moving to the laboratory part of the study, 170 patients, clinically suspected patients were included. Blood and urine samples were collected, confirmed the diagnosis based on the 3 tests, culture, MET, and PCR. And another serum sample was collected and subjected for cytokine studies. For the cytokine studies, age-sex matched, healthy control also included. A urine sample was collected to identify the urine markers which can be proposed as acute kidney injury markers. Coming to the results of the first part of the laboratory findings, out of the 179 clinically suspected patients, 79 were confirmed as leptospirosis based on these 3 confirmatory tests. Majority were male patients and were farmers. The sensitivity of the real-time PCR was high compared to the other 2 confirmatory tests. The sensitivity of the culture was less, and even MAT gave a sensitivity of only 44 samples were positive using MAT. Acute kidney injury was the commonest complication in our study population, followed by meningitis, myocarditis, pulmonary hemorrhagic syndrome, and acute liver failure. The PCR positive samples were subjected to partial sequencing to identify the circulating strain. Based on that result, Leptospira interrogans was the commonest strain circulating during that period. And this Leptospira interrogans was associated with acute kidney injury, liver insufficiency, myocarditis, and severe pulmonary hemorrhagic syndrome. So during that period, from Tengol samples, we were able to identify Leptospira bergpetzni. So this strain is not a common strain which is commonly isolated from human, but it is mainly isolated from cattle. So we can think that cattle is also an important source, reservoir animal for our country. And this Leptospira bergpetzni is predominantly associated with liver insufficiency. The Leptospira kirchneri also we identified, and this was predominantly associated with acute kidney injury. When with the phylogenetic analysis results, we found that the strains circulating during this period has similar relationship with the strains which circulated during the 2008 outbreak. The culture isolation result, culture was the least sensitive technique, although it is a confirmatory diagnosis. Only 2 gave positive out of 170. We managed to do the sequencing and identified these 2 as Leptospira interrogans. So interestingly, we were able to publish this in Medical Microbiology Journal. Actually, this publication went from Sri Lanka after 30 years of a gap, based on culture. So, whether there is any relationship between the bacteremia and the disease severity. We believe that bacterial load contribute to the disease severity. So we did a quantitative PCR. Bacterial load was calculated using the standard curve and tried to correlate the bacterial load with disease severity. However, we could not establish any relationship with the bacterial load and the disease severity. The similar findings were observed during that time by Professor Agampodi's group, and we think that the reason is mainly the patients, when presenting even, they are on antibiotics, and they will be continuously on antibiotics. So antibiotics reduce the bacterial load. That may be the reason that we could not establish any relationship between the load with the severe disease. So let's move to the results of the host factors, understanding the immune response in leptospirosis. We wanted to evaluate what immune pathways are important and contribute for this pathophysiology of leptospirosis. Th1, Th2 pathway is studied, but a little attention is being paid on Th17 pathway. We think this pathway is important because this organism is an extracellular pathogen. So when we did a literature survey, there are evidence about extracellular pathogens had a significant role in this Th17 pathway. So we wanted to explore that. So under that, we studied several cytokines, IL-21, 23, IL-17, and tumor necrotic factor TNF. And we tried to correlate the outcome with the disease severity. The results. The cytokine expression, we observed a significant elevation in IL-21 and IL-23 in patients with leptospirosis. And also, there was a significant expression in these two cytokines with patients with acute kidney injury, and also with patients who had liver insufficiency. The levels of TL17 was elevated without any significance. So we could propose that elevation of IL-17 together with the significant elevation of IL-21, 23 suggests a possible role in Th17 pathway in immunopathogenesis of leptospirosis. Moving to the results of tumor necrotic factor, which is a pro-inflammatory cytokine. This, unlike the other cytokines, this TNF-alpha is being well studied, and it is known that this pro-inflammatory cytokine is high in patients with leptospirosis. And also, there is this relationship with the disease severity. But however, when we did the literature survey, we could not find any papers mainly related to this TNF-alpha receptor 1. And also, the TNF-alpha gene polymorphisms. So why we think of gene polymorphisms? And because this leptospira, there are more than 200 serovars. There can be always geographical variation. So pathogen and host genetic factors affect the immune response. So as a whole, to get a better understanding of this tumor necrotic factor, we wanted to look into TNF, the receptor, as well as the associated mutations. Coming to the results, the expression of human TNF-alpha was significantly elevated in patients with leptospirosis compared to the healthy controls. When coming to the soluble receptor, in patients, this was significantly suppressed compared to the healthy control. And when we analyzed the ratio, that is the receptor to the TNF ratio, again, in patients, this was significantly suppressed. So what does it mean? Soluble TNF-R1 receptor binds to the TNF and acting as a TNF inhibitor. So what will happen if there is no receptor? Then it will exert pro-inflammatory signaling, which can lead to severe consequences. However, we could not establish any relationship with the gene polymorphisms. So this may be due to low frequency of heterozygous and mutated genes in the present study population. So we think it's better to do another study to come to a conclusion of the contribution of TNF as a whole for the disease severity. Moving to the IL-10, IL-10 is an anti-inflammatory marker. IL-10 levels were significantly elevated in patients with leptospirosis compared to the controls. And again, the IL-10 levels were significantly elevated in patients who had complications. And the most important finding is this IL-10, the elevation was significant at the early stage of fever, that is, less than 6 days of fever. And also, it has a significant association with mortality. Then we did the IL-10 to TNF-alpha ratio. Here again, the ratio was significantly elevated in patients with complications, with mortality, and this ratio, again, significantly elevation was seen in the early stage of fever. This is very important finding. So what we can conclude? To summarize again, among patients with complications less than 6 days of fever, IL-10 was elevated, the ratio IL-10 to TNF-alpha was elevated, and therefore we can think that this can be a good predictor of disease prognosis. Right, let's move to the third part of the study. Based on our findings so far, the acute kidney injury was the commonest complication during that time in our study population. So we wanted to see whether we can propose any biomarker which we can use at the early stage to catch these patients who develops acute kidney injury. This acute kidney injury is mainly diagnosed based on the serum creatinine level and urine output. And this serum creatinine levels rise when there is, especially the disease is established. We identified 2 markers, kidney injury molecule 1 and monocyte chemotactin protein 1, MCP1. And for this study, we collected 170 patient samples, confirmed the diagnosis based on the confirmatory tests. Out of the 170, 79 had leptospirosis, confirmed patients, out of which 19 had AKI. 60 were non-AKI patients. Among the unconfirmed 91 patients, 6 had AKI, other 85 did not have AKI. The Keat-Gau scale was used to categorize the status of AKI. And this was done by the clinicians who were team members. Coming to the results, serum KIM1 was significantly expressed in patients with acute kidney injury compared to the patients without AKI. And again, this was significantly increased compared to the confirmed patients compared to the unconfirmed patients. Serum MCP1 also, there was a significant elevation in MCP1 in patients who had acute kidney injury among the patient group compared to the unconfirmed group. Coming to the results of the urine KIM1, we observed the similar results where significant elevation was seen in AKI patients compared to the other non-AKI patients. To summarize that result, medium serum KIM-1 and urine KIM-1 levels were significantly higher in patients who developed AKI. So this elevation, KIM-1 expression, was nearly 4-fold higher in patients. Another important thing is the AKI levels were elevated in early stage of the disease, that is between 5 to 6 days. KIM-1 had higher sensitivity and specificity compared to the MCP-1. So with that, we obtained these results after growing the ROC curve, and specificity, sensitivity cutoff values were obtained. And finally, we conclude that serum KIM-1 is a promising biomarker for leptospirosis-associated AKI. And this we can use as an early biomarker. So, ladies and gentlemen, we have just started our research. There's a lot to explore. With all my findings so far, we believe that we add some knowledge to the pathophysiology of leptospirosis. However, still we cannot draw a line diagram. There's a lot more to study and confirm. And also, we believe that we found several important markers which in the future, after proper validation, could be used as biomarkers. Now, where are we heading? So this is again based on our findings. The patients who had pulmonary hemorrhagic syndrome they had high fatality. So we wanted to explore the leptospira-associated pulmonary hemorrhagic syndrome. This we are doing. The head is actually Dr. Nilanka from medicine department. So here we wanted to explore the pathophysiology of pulmonary hemorrhagic syndrome because the mortality is high. We don't know anything and nothing is confirmed. And we wanted to see a separate set of markers, especially ICM, VCAM, and E-selectin. So those are adhesion molecules and molecules related to vasculitis. So my dear colleagues, madams and sirs, the work that I have presented here tonight is hard work with many eminent researchers. The senior professor, Neluka Fernando, madam is not here today. Professor Chintika Gunasekara from my department, and Professor Chamil Marasinghe, Dr. Nilantha Ranasinghe, who gave us immense support for the clinical part of the research, and Professor Chandrika Gamage from Peradeniya Medical Faculty, and Professor Menaka Hapugata from Ragama Medical Faculty, who supported us for giving the technical expertise. And all these lovely faces from my department, each one of them contributed immensely to uplift the research in my department. Thank you so much. And also, two of our main PhD students, Kanchana, she is our first PhD student, and then Dr. Tilini. And now it's Dr. Madhushika from Vayamba Microbiology Department. Thank you so much for your hard work. And I want to thank University Grants, University of Sri Jawadhanapura supported us for all this research. Finally, I want to thank to my dear parents. Thank you, Ammi. Thank you, Tati, for your support. Without you both, nothing would have been possible. Thank you so much for everything that you did. And finally, I want to thank Nilantha, anyway, he's the part of the team, and Rusandi, my daughter, for their love, care, and support. Thank you so much, sirs and madams, and my dear colleagues, for your patience listening. Thank you.